Hi everybody, I am Jenny, and this channel is dedicated to school counselors that want to look into being therapists and starting their own private practice. And so today's video is going to be a continuation of looking at all the paperwork that goes into seeing clients. We talked in past videos about getting started and all the paperwork to do intakes and to do the initial clinical assessment. And today we're going to look at the progress note, which is going to be what you use the majority of the time after you do the intake and in between all the sessions that you have until you eventually terminate with the client. You'll do progress notes all along the way, including for that first intake visit. See here, I've got Toby, our mock client, up and running, and you can see all the things that are in his chart. We can go to the very beginning of the chart, the diagnosis and treatment plan. All of that was covered in previous videos. And then today we're going to look more at the progress note and what you're going to do for that. So even with that first visit, you're going to have a progress note, and in that progress note you are going to put that it was the initial visit. So let's look at that. I'm going to go ahead and edit this so that we can actually see what all the fields are asking about. So the first part of the progress note is what I call administrative details. This is going to be things like the date, the time. You want to put the exact start and stop time and the actual duration of the session. Procedure code is a billing code. This is used by insurance. And for the very first session, we're going to say it's a 90791. That's the code for intake and assessment. The other codes that I have pre-populated are the ones that I tend to use. These are individual psychotherapy codes, and which one you use depends on how long the session goes for. So don't quote me on this, but I believe that a 90832 is anything that lasts 16 minutes all the way up to like 37 minutes. And 90834 goes from 38 minutes to 52. And then a 90837 is anything that lasts 53 minutes or longer. It could be however long. You don't get paid anything extra after 53 minutes. So you would put whatever your billing code is. Place of service. When I do a virtual session, I have a space to say exactly where the client is located, and I try to make sure each time that I'm meeting with them that I know where they actually are for safety reasons. And then I also have some check marks here to help me remember to just check in and make sure about, are they in a good location for doing the session, and are they in a good place kind of mentally to do a virtual session? If they are in crisis, it wouldn't probably be the best thing to do that. Type of session, usually for me, is individual. There's other options that I have here. So if you do other kinds of things like couple, group, family, there. Who was present today? Was this a scheduled visit or not? And then for the diagnosis, I have his diagnosis in there. For the reason for the visit, I actually tie it back to the treatment plan goals. And I just put those goals straight into the progress note. So I can kind of continuously be ensuring that I'm focused on those treatment plan goals and that whatever we're doing in each of the sessions after creating that treatment plan, it relates to those goals and to the treatment plan And those goals and that treatment plan are also tied to the diagnosis, which is tied to that initial intake and the assessment and all that information that we gathered to try to figure out what's going on with this client and what are we doing, how are we going to help and why. So everything relates back to that beginning, and there's kind of what they call a golden thread that would go all the way through whatever we start with that treatment plan, the diagnosis, the goals, and everything that we do for each session would kind of keep that in mind and help us get to our final destination, which the goals help to determine. And so you can see here, Toby's goals are to reduce anxiety, improve his relationship, and decrease that feeling of hopelessness. So we address this by discussing his patterns in his relationship with his wife. And that's what we did today. And I think I put that with the idea that this would be not the intake session, but would actually be like after the intake session if we were doing another session after that. So maybe it's a 90837. We're going for over 53-minute session after the intake. And if this was the 90791 initial visit, maybe what I would put there is, today we address his treatment plan goals by collaborating and developing the treatment plan itself. So you can kind of look at that and figure out what you would want to put. For the target symptoms, this is what we addressed in the visit today, and I put a little blurb for each of those symptoms, what kind of went into what we addressed for each symptom. And of course, that is a little bit subjective, so you can decide for yourself what makes sense there. Subjective data, so the template that I'm showing you is from the kind of one of the standard ways of doing psychotherapy notes, which is called a SOAP note. So S is for subjective. That's going to be what your client is actually telling you. And I like to put some little direct quotes in there. It helps to show that this was unique, that that this information is specific to today's visit, not just any visit. And so you can see what I put there. And then we're moving into the O portion of the SOAP note. So this is the objective kind of details. What did I notice about Toby that I could say objectively? His affect, I have a list of options there and I checked them off. In one of the trainings that I did kind of recently, she suggested that we always put that they were motivated and engaged. So I forgot to mark engaged, but there you go. And that just shows that, the session kind of fulfilled its purpose. The client was appropriately involved in this treatment session. And then you can put whatever other markers make sense. And then I have a little narrative where I can put more details. I might say, visually, Toby was, slumped in his chair and did not sustain eye contact. Or I can put details about his thinking process or more information about the emotions that I noticed with Toby. The assessment, so that's going to be the A from SOAP. This is where, as you can see here, I put a little blurb to remind myself. This is where the therapist talks about how are they making sense of the verbal and behavioral information that is presented. And to not kind of put it in terms of like, well, I know what's going on, but to kind of give some conjecture, room for it to be a hypothesis that, we can check out along the way. But in this case, you can see I put that Toby it may be that Toby's anxiety is getting in the way of him feeling like he belongs and can connect with others. And it also appears that when he is anxious, this energy might be turning off his partner and causing more misunderstandings between them. And so that relates back to some of his treatment goals and what he's going to therapy for. So I'm helping to kind of make sense of okay, what am I noticing? What are the observations? How does that relate to maybe the bigger picture? And then the mental status exam is something that we do every time. It's part of the assessment to just kind of check in, and you can see here the fields and what they're asking about. The thinking, appearance, attitude, functioning. Are they able to function okay or not? Thought process, motor activity. The orientation, this is going to be, sometimes you'll see this in terms of orientation times 3 or orientation times 4. But do they know who they are, where they are, what time it is, what context they are experiencing right now? And then, do they have any risks going on? If so, for what items? And then what is going into that risk, if there is risk involved? Do they have passive thinking, for example, about suicide, but no plan or intent, versus some of those other things as you see listed? And then what's the overall risk level? Making sure that we have a safety plan in place when needed. And I would say if the risk is anything other than low, I would do a safety plan. Then there's some other questions about, has the client had any significant life events happen or changes to medications since we met last? And then just a reminder to look at medications and kind of just the physical health aspect of our clients as we go along, because those things can impact mental health and vice versa. And then the interventions. So I have some modalities that I tend to use listed here. Today I put emotionally focused was the one that I used. Then I have a narrative, and I like to put the name of the intervention and description. And I like to list about 3 or 4 at a minimum interventions, especially for an hour-long session. You want to have enough interventions to kind of show what were we doing with all that time. It really does go by fairly quickly, a lot of times, an hour. But I put, after listing the interventions, what actually did that look like specifically for our session today? What did I do, and how did Toby respond? So this is just an example. But for emotionally focused therapy, you want to establish emotional safety, and the relationship is a huge part of EFT, so that's one of the interventions listed. Tracking patterns and themes is another big part of EFIT. And then focusing on present emotional experiences, asking, how are you feeling? What are you noticing right now? What's coming up for you as you talk about this? And then reframing some experiences. So for my example, I said, I actively listened as Toby shared his experiences of the past week through reflection and summarization. Toby responded with sharing more of his story and appeared to relax as the session progressed. So that's trying to address that intervention of establishing emotional safety. I offered some observations to Toby about the way it seems the more anxious he becomes, the more his partner Annie pushes him away. So that's kind of noting some of the patterns. And he said he hadn't realized this part of the pattern before, but it made sense. So that's his response to intervention. So for each of these, you're looking at the intervention and the response. And then when I asked Toby to share how he was feeling right now, upon noticing a look of surprise on his face, he became frozen and fixated on looking at something out of the window. And then I invited Toby to consider that he can do some things to change his level and expression of anxiety, which could then change part of the pattern between himself and his wife. He smiled a little at that and seemed engaged with thinking through how he might be able to have more hope for himself and his relationship after all. So after going through the intervention portion of this progress note, then we can look at why did we use these particular interventions or modalities? So we can check off the things that make sense from that list. Progress, how is Toby doing with progressing towards his goals based on the information gathered in today's session? And then I write a little narrative to go along with that. And then the plan. So that's the final P in the SOAP note is, what are we going to do moving forward? What are our next steps? And then, are we going to keep going with this therapeutic focus? Are we going to change it? Are we terminating treatment? And then, am I going to coordinate with any third parties? Did I make any referrals? The date of the next session. Prognosis. How do I feel like Toby's going to do with treatment overall? And then just a little something to justify the medical necessity of today's session. So this all ties back to, okay, he's got these symptoms, this assessment was done, we came up with this diagnosis, and this treatment plan to go with it to address what he's wanting to address. And now in today's progress note, I'm showing we did this session, and here's how we addressed those initial things that we talked about wanting to address in treatment. So that is, I save this, I will sign it, and then that gives us basically everything we need to do a progress note. Next time, I will talk to you about the discharge summary note, which is what you're going to do whenever you terminate with a client. So until then, I wish you well, and please remember, you have options and opportunities. See you soon.